going to talk about the target blood glucose levels for a lady who has diabetes in pregnancy, who is diabetic and is pregnant for any diabetes. So, to remember the levels, we have to remember this lady. Now, one thing that we have to remember is this bow and arrow, because when we talk about targets, it is hit with an arrow. Okay, so basically, a hand holding a bow is what we are trying to remember. To remember two things. First is that this picture depicts that we are talking about the target blood glucose levels. And secondly, this lady who's just woken up, she woke up because she had a bad dream about a war. We can see this hand holding a bow. So this lady is upset and now she is going to check her fasting blood glucose, capillary fasting blood glucose, and the value is expected to be within 5.3. Now, if we precisely look at this hand and this bow, the 5 fingers of the hand stand for the number 5, and the shape of the bow is precisely representing the numerical 3. So 5.3 is, I've tried to represent it with a hand holding a bow so that you can remember it as a lady who had a bad dream. We're talking about targets. So a bow and a hand is precisely used to remember the numerical 5.3. So 5.3 millimoles per liter is what we're trying to remember. So fasting, this lady woke up from a bad dream about this hand and a bow. So definitely she's just woken up. It is her fasting, which is expected to be within 5.3 millimoles per liter. Now this lady knows that she has got diabetes. So she will be checking her capillary plasma glucose again, obviously, in the other parts of the day as well. So now she was waking up, she's checked her fasting capillary glucose, and now she's taking food. Now she knows that she has to check her blood sugar again within 1 hour. This is an hourglass. So again within 1 hour. So within 1 hour she plans up to go for shopping. She thinks that within 1 hour, I have 1 hour's time, after which I have to check my sugar after food. So she takes food and she quickly goes for shopping, and she plans that I'll return in an hour and I'll check my blood sugar. So 1 hour that I have in hand, I'll utilize it shopping. And why shopping? Because the shopping cart is in the shape of a 7 and 8. So 7.8 is the value within which we expect our capillary plasma glucose to be after 1 hour of having a meal. So she goes shopping, she comes back and she checks her 1 hour post food plasma glucose. Now she has been told that once more you have to check your plasma glucose after food, after 1 hour again. Then she decides, okay, I have 1 more hour, I'll go and play a golf match. I'll go and play a golf match and then again come back in an hour, which is of course 2 hours from the food and 1 hour from the last value. So after shopping, she gets 1 more hour. And now she wants to play a golf match. Why golf match is important? After the golf match, she will check her blood sugar, and that should be, if we see this stick and flag, golf stick and flag, it is in the shape of 6 and 4. So 6.4 is what we're trying to Remember, so 2 hours post meal, her sugar is expected to be less than 6.4. So, this is how we can remember the targets that we have to meet when a patient is diabetic and is pregnant. So the values of her fasting, her 1 hour pp and 2 hour pp are expected to be in this range. This is the easiest way I think we can think of remembering these numericals, because there are a lot of numericals in this particular article. So it's very, very good if we can remember it through short stories, so that we have these values in our long term memory and we can solve questions and also handle patients easily and effectively. Thank you.